Good morning, everyone. Good morning. My name is Jenna Nelson, and I am the Executive Director for the North Carolina Early Education Coalition, which is the backbone organization for the Think Babies North Carolina Alliance leadership team. And we are going to talk a little bit more about what that leadership team is. But first, we wanted to get to know all of you just a little bit. So if you would just put your name, your organization, and where you are zooming in from today in the chat, and that will give us just a quick minute to introduce each other. And I'm going to hand it over to Angela to introduce herself while you all are introducing yourselves in the chat.
Thanks, Jenna. Hi, everyone. Good morning. My name is Angela Birch-Achatry. I am with the North Carolina Early Education Coalition as the Administrative Director, but also as the Think Babies NC Alliance Project Manager. So we are happy to be with you this morning and share a little bit about Think Babies NC and our micro grants and kind of all the work that we've been doing and what we've learned. It's good to see everyone in the chat, some familiar names and some new names that we're happy to have with you, and hopefully everyone can learn something new from this session. So I'm going to start sharing my screen, Jenna, and take it away.
Thanks so much, Angela. I'm going to quickly go through the outline for today, so you can move it to the next slide. I do just want to let everyone know that we are going to try to make this as interactive and engaging as possible, and not just folks reading a PowerPoint to you for an hour and a half. So be ready because we will do a couple of small groups, and we will have a Googling activity for you all to do. So So we hope that we don't just lose everybody when we go to small groups. We hope that you all will turn off your cameras and engage with one another so that we keep the session moving and it's as engaging as possible. So as I mentioned in my introduction, we are going to talk about Think Babies and what are the goals of the collaborative. We are also going to learn more about the PN3 policy roadmap. We're going to dissect and discuss intentional ways that this particular RFA that we're going to talk about today was crafted and revised in response to BIPOC-led organizations' concerns. And we're going to talk about how the leadership team members plan to support communities in building relationships with policymakers. So those are our goals for today, our outline for today. So what is the Think Babies trademarked Alliance leadership team anyway? You've probably heard a lot about Think Babies, especially if you're zooming in from North Carolina today. And so what the leadership team does is we seek to ensure that the very youngest children prenatal to age 3 benefit from effective and equitable policies, programs, and funding so that all children have what they need to thrive. I like to break this down a little bit. If Angela will just move it to the next slide. Sometimes it's hard to dissect sort of all the words that are in our mission and our visions. And so the Think Babies North Carolina Alliance leadership team is a group of organizations that all inform policy. And we seek to ensure that the youngest children benefit. And so we really make sure that policymakers prioritize pregnant women, infants, and toddlers. So that is the goal of this group of organizations that inform policy. And what we do is we make sure that those policymakers are prioritizing pregnant women, infants, and toddlers. And we have 3 main focus areas: health, family support, and childcare. So I hope that helps break down sort of what the Alliance is, because sometimes it can be difficult to kind of digest all of those words. So our mission is really bringing that prenatal to 3 focus. So again, ensure educated policymakers. Make sure we educate them, help them to understand why is prenatal to 3 a focus? Why are we focusing on that particular period of life, and really help those policymakers support equitable changes. So making sure programs are funded, policies are written in equitable ways, and that programs are delivered in equitable ways. And we have a coordinated cross-sector network of leaders in the early childhood community across the state of North Carolina, with an intentional focus on communities of color and those furthest from opportunities. I'm going to hand it over to Angela next to talk more about the history and who makes up the Think Babies Alliance.
Thanks, Jenna. So yeah, where did Think Babies come from? How did this all happen? Well, way back in 2018, which seems like way more than 4 years ago, just around this time though, North Carolina was actually sought out by 2 national funders, the Pritzker Children's Initiative and 0 to 3. And because of the progress that North Carolina has made for early childhood, for example, Smart Start, and has a reputation for advancing policies in the best interest of children, North Carolina was sought out to become one of the first Think Babies states. So 0 to 3 had states that it was kicking off its prenatal to 3 initiative. Pritzker Children's Initiative had states that it was kicking off its prenatal 3 initiative. And they wanted to combine in North Carolina to support that work. So the North Carolina Early Education Coalition, with the fiscal sponsor of CCSA, the North Carolina Early Childhood Foundation, and the Department of Health and Human Services all received funding in that first round. They received funding for a first year to support a multifaceted, inside-out policy approach. So since that time, we are now in our 5th year of funding from 0 to 3. We just completed an interim report for essentially the halfway point of a 3-year grant round from Pritzker Children's Initiative. And the North Carolina Early Education Coalition serves as the primary grantee and the backbone organization for the Think Babies NC Alliance. So what is the Alliance? This is the Alliance. This is our leadership team. This is a group of 27 cross-sector, public, private, government, nonprofit organizations that focus on any of our policy priorities, which we'll get to in a minute. And those include healthy beginnings, supported families, and early education. So these are the groups that have come together. We have grown significantly from that first meeting, which was actually in May of 2018, where we had maybe 14 people at the table. Now we have 27 organizations, roughly 50 representatives from those organizations. And whereas we were previously met quarterly, we're now meeting monthly to keep up the work and keep the initiative moving forward. So what do we do? Well, Jenna kind of went through what we did, but another way of looking at it is that what we believe is that when we think babies, we create stronger families, vibrant communities, and a prosperous future for North Carolina. And how we do that is developing a prenatal to 3 public policy agenda that strives to improve equity and eliminate disparities, because none of these policies are helpful if they're not addressing the needs of all communities and providing equitable services. So once we develop that policy agenda, we create and implement a coordinated campaign to achieve our policy goals. So that first policy agenda was developed in 2018, roughly 6 months after we all came together. It was an experience to get those organizations all on the same page and come up with our policy agenda and what we wanted to move forward with. Since then, and that was in preparation for the 2019 legislative long session. So again, just as a reminder, this also comes back to policy, moving policy forward in North Carolina for babies and their families. Babies and their grown-ups, I actually like to say, because it's their families, but we also have a very strong focus on early educators, because everyone who comes in contact with these babies don't grow up in silos. They have families, they have early educators. Everyone needs to be taken care of for the best interest of the babies and families. So that first policy agenda was developed in 2018 in preparation for the 2019 session. We revisited and revised that for 2021. And we are now in the process of looking ahead to the 2023 legislative long session. We're going to look at our policy agendas again, see where we've made advances, see where we need to tweak things. There's also been a lot of racial equity work that the leadership team has been doing. So our racial equity lens is becoming more focused, and we can use that lens to evaluate our policy agenda as well. So these are our current policy priorities. Like I said, these were developed for the 2021 long session. It says 2021 to 2025, but we know a lot of things have been, a lot of things have changed in our political landscape and as far as policies. So as we've referred to several times, these are the three buckets that we look at our policy priorities in: healthy beginnings, supported families, and early care and learning. So a few places that we have made advances, we haven't gotten to Medicaid expansion yet, but we did get postpartum care extended, which was a big win, and will be great for our mamas and babies in North Carolina. Workplace pregnancy accommodations. Back in 2018, we had an executive order for government employees, which supported, gave protections and support for our pregnant moms who work in the government. And as far as paid leave, which is under supported families, a lot of that momentum has been taking place at our local government level. So there's roughly 20, maybe a little more than 20 local governments and municipalities across the state that have implemented a paid leave policy of some kind. So continuing under supported families, you know, the earned income tax credit, we know that was in place for a while and it's gone away. We're working to get that back. Not a lot of progress there, but we have the information about how it's affected people. We can use those stories to hopefully get it back in place. And then under early care and learning, subsidy rates, expanding the subsidy, getting the subsidy rates to a higher rate, and then of course building the supply of infant and toddler child care. Most of the counties in North Carolina are child care deserts, and that most specifically affects infants and toddlers. And so, of course, as I'm sure this group knows, any work on childcare, you have to look at the compensation of the teachers. And because Think Babies is infant toddler focused, we are focusing on the infant toddler workforce. So things like the awards compensation program, we support that and want to expand that as well. So that comes to a couple of more broad initiatives. The home visiting and parenting education systems planning, which has been taking place for a few years because systems change takes time. When made a huge leap last year when they hired the systems planning director, Rachel Borrello, and a lot of that work comes out of NCPC, and a lot of work has been done to get things in place to move that forward, and progress is being made. The infant toddler child care initiatives are things like I just mentioned, the infant toddler child care awards, which is a compensation program specifically for infant and toddler teachers, similar to wages across, which is available in some counties across the state. The paid leave and pregnancy accommodations. Like I said, that made a leap with the governor's executive order, but we haven't done much since then as far as broad-based progress. But a lot of that work is with the support of Moms Rising that focuses on those issues across the country. And then what we're going to really kind of hone in on is our Think Babies NC microgrant community partners. Since 2018, we've funded 4 rounds of micro grants, and it's really the connection between our state and national level work and the communities that are affected by that work, looking at partners to really get that momentum at the community level, and supporting their contact with their policymakers, to let their policymakers know that they want these policies for their babies and families. I'm gonna hand it back over to Jenna.
Awesome. Thank you. So that was a lot of information. We just wanted to make sure that you all sort of had the same foundational understanding of what the Think Babies North Carolina Alliance Leadership Team is and what we do. And now we're going to really dive into our community level micro grants. Many of you, at least the names I recognize, and as you're putting your names into the chat, introducing yourselves, are working at the local level. And so what we're going to do is we're going to have 8 breakout rooms. And we would love for you all to come off camera if you can, and it's okay if you can't, and to answer these questions as just as a small group. So what do you think is the beauty of doing community level policy work? What are the pros and cons to community level policy work? Why do you think the Think Babies NC Alliance chose to work at the community level? And what policy successes have you seen happen at the local level? So I will put these questions into the chat, or if you want to do a quick screenshot or take a picture with your phone. I know sometimes it's hard once we go into the Zoom breakout rooms to remember what the questions are, but you can copy and paste from what Angela just put in and bring that with you to the breakout rooms. And so you'll have 10 minutes. Again, just share, discuss. If someone in your group will offer to just take a few notes, and then if someone in the group will be willing to share back with the small group, with the large group, what your conversations, what kinds of things bubble up in your conversation. So I think Eric is going to break us out now, and we will see you back in 10 minutes.
I'm closing the rooms. I forgot to give them a minute grace period, so they'll be here.
Welcome back. I know folks are still popping on, but in the interest of time, we'll go ahead and get started. We don't need to hear from every single group about every single question, so feel free to jump in for those of you who volunteered for your group to be the person who shares. So what do you think is the beauty of doing community level policy work? Is there anyone who's willing to come off mute and share what their group discussed around the beauty of policy work at the community level?
I'll break the ice and excuse my background and shout out to group 7. I accidentally hit the leave button when we had a minute left, so I'm sorry. But there was a lot of great discussion in our group, particularly for that first question. It fits the community specifically, so particularly like community needs. And it allows, not every community is the same, and so it allows for a little bit more focus on genuine needs that need to be offered in resources. And the local level sometimes usually doesn't take as long as systemic levels in order to enact the change we hope to seek. And we have a better grasp what the needs are, what resources you have to address those needs, whether it be rural or urban. You know who and what populations to target. You can hold policy members a little bit more accountable. In the local level, you're able to kind of pivot a little bit more to address needs, while on a systemic level, it's kind of hard to make turns and adjust as needed. One of the cool things as well that was mentioned was you're able to see the evolution of families who benefit from the services we provide. Specifically, let's say a teenage mother and who's now post-graduation, now in the workforce or in college and things along those lines. So it's reaffirming and just satisfying to be able to see that evolution as well. But those were a couple of the points that we brought up in our group 7. Shout out to group 7.
That's awesome. Thank you, group 7. Those were really, really, really great points. Anyone else have anything to add?
Well, I'm with group 8. Shout out to my group, group 8. Whoop, whoop, put your hands in the air. I was telling, about the beauty of everything that the Think Babies and the other community organizations that are aiming, are shooting for with legislations and fighting with policies and having those hot ticket items to come to the forefront to make it feasible for moms and dads to get those that time with their families and giving that paid leave without being penalized for spending that time with their children. Because when you speak about 0 to prenatal, those are the most important years that mom and dads need to spend with their children, and having those resources for moms who go through postpartum and getting the necessary care that they need. But it was a lot other things that was talked about, Jenna. But Think Babies is an organization that is a great collaboration where providers and families meet together to make these changes that are necessary and to write letters and tell stories that are personable, because we can write generic letters to legislations, but when you put a story behind the changes that needs to happen, it'll make a big impact, especially for the middle and lower class families who are being affected by these decisions that are being made.
Thank you so much. Really great points already brought up. Moving just quickly through these, what are some of the pros, which I know we talked about some of the pros, what are some of the cons? Anyone else want to add in the pros and cons to community level policy work?
I'll represent our group. I have no idea what number we were, but it was me, Lori, Carla, Christy, Bethany, and Elizabeth. So I think we a lot of the pros were shared, but I think our cons were at the local level, you get comfortable staying in one spot. And then there was kind of a fear if you're doing it locally, running rogue and not complementing a statewide effort, and then that, which led into the biggest issue, which we saw as equity. The equity issues across the state, and the fact that not all services are available, not all resources are available in every county, and how do you take that into consideration when you're doing local work? So those are the biggest ones we hit.
Those are really great. Thanks for bringing those up.
I feel like I'm in a friendly competition with Group 8 and Karita now, so shout out to Group 7 again. But some of the things we mentioned were burnout on the local level, because it sometimes has a tendency to hit a little bit closer to home and have that toll on us. Also, there's always more to be done on the local level. In addition, the state level doesn't always hear the needs of the local level. Sometimes there's high rates of turnover in positions, and so those projects and initiatives aren't continuous. So that work's just not being continued. It can be difficult to galvanize sometimes community collective action at commissioners meetings, town council meetings, Board of Education, Chamber of Commerce. And even there's a huge lack of representation, I believe, on local offices as well, of the people that they're representing. So once again, Group 7, nice. I love you still, Karita, though. Those are great points, but it's friendly competition.
I love it. So why do you think the Think Babies NC Alliance chose to work at the community level? Why do you think we took this sum, of our resources for the statewide work that the Alliance does? Why do you think we chose to pivot and put some of those resources into local communities?
Hello, my name is Stacy Baker, and I know in my group we talked about how we think you guys took up that charge because the pros still outweigh the cons as far as working with the community level, and also because you guys did a great job of just assessing the community, and from your assessments, that's how you guys best decided you guys could serve that community at hand, is by doing the community level micro grants. So if anybody else wants to add anything to that, once he started mentioning friendly competition, I started to want to tap in more. So I appreciate that.
Thank you, Stacy, and I love the competition getting our juices flowing this morning. Love it. And then, what policy successes have you seen happen? I'm sure you all have seen a lot, but is there anyone who wants to come off mute and just share some of the local level policy successes that you've seen?
Well, Jenna, I would love to come off and say something about just successes in general. We have I'm in Union County in North Carolina, and we have been able to be a part of one of the mini grants, the micro grants, in the past. And that began, had our conversation started. Well, we have a Monroe new science center that will be opening soon in Union County. And two things that might not have happened as a result are, number one, we have a special mother's room for breastfeeding, for nursing, for taking care of children that will be opening there. And the other, another local nonprofit has funded a sensory room just for those smallest children who need that break and can't go, around in the rest of the sites. That seems like, it doesn't seem like a win, but it is. That's a win for us. In everything we do, we hear and see more that people are engaged in the youngest, because we have to say this in early childhood, oftentimes we look at 4 and 5 year olds or 3 and 4 year olds as those who really are, ready to start, but that's not where it starts. And even our Chamber of Commerce president now quotes me and says, workforce development begins at birth, which is a win.
Thank you so much, Linda, for sharing. That is such a great story. And absolutely, those are huge wins. And what a great resource and asset for your community. I mean, that's amazing.
Thank you.
Well, in the interest of time, we'll just go back to sort of our next section, but sounds like you all had some really good conversations, and you all really understand why the Think Babies Alliance felt the need to invest in some policy levers at the local level. And so just full disclosure, for those of you who may not know me, I have a long history of working in early childhood in North Carolina, and most recently I spent about 5 years at NCPC. So I am a former Smart Start employee, and I had the absolute pleasure of getting to know so many of you at the local level. And I saw how close-knit your communities are. And every time I went to visit an executive director and their staff, we would go out to lunch and we would run into a local someone, the mayor, a county commissioner, someone who sits on the city council, the superintendent of the school district. And so what we did, bringing sort of my intimate knowledge of how powerful local communities are in the world of policy, and coupling that with the success that we've had in the past with microgrants, we sought an additional grant from the Pritzker Children's Initiative to, I often say it's sort of microgrants on steroids. And it's an even bigger, better microgrant experience this year, where we're actually developing leadership communities. So each community selected will receive support, monetary and also support from the coalition staff, to form a team of prenatal to 3-year-old stakeholders. Many communities already have those teams. So it's kind of building on the work that communities have already been doing, with a focus really on ensuring underrepresented populations are at that table. So parents of young children, BIPOC-led organizations, early childhood educators, and other community members. We will be doing a virtual information session on the PN3 policy roadmap, which we're going to talk about in a minute, which is why there's an asterisk there. And then each community will select one area, or at least one area of the policy roadmap that is really interesting to them and really resonates. You all brought up such great points. What resonates in one community might not resonate in another. And so each community will be able to decide which piece of the PN3 policy roadmap they can dive into. And then the team will be tasked with hosting between 1 and 3 events to connect with policymakers. So again, down at the barbecue restaurant, over at the donut shop, in the church, rec hall, bringing those policymakers to the table and having the community express why this is important, why this policy will change the lives of of young children in their community, and as Angela said, they're grown-ups, and hopefully building a statewide conversation about the policies and strategies that are in the PN3 policy roadmap. So again, each county or sort of regional area will be established. And Angela, correct me if I'm wrong, I think we're actually going to talk about the communities that were selected this year, but it was seven communities. And so again, they're going to build this bigger, greater awareness and understanding of the needs of infants and toddlers. And then of course, the specific strategies in the PN3 policy roadmap. We will develop customized resources and tools. So again, they'll pick an area of the PN3 policy roadmap. And then we at the coalition will say, you know, in your county, here is information related to that policy and all of the infants and toddlers in your community. So they'll hold these events and then we'll develop these new champions. So this is where we are going to do some Googling. So again, I am not a huge fan of sitting and listening. I need to kind of do to understand. And so what I would like for you to do, we're going to drop a link to a Jamboard in the chat. A Jamboard is a tool that hopefully you'll be able to access easily from your device, where you can just put sticky notes. You can put sticky notes on the Jamboard. And so we want you to use your favorite search engine. So I always say Google, but folks use different search engines, and just type in, what is the PN3 policy roadmap? What are effective policies according to the PN3 policy roadmap? And what are effective strategies according to the PN3 policy roadmap? And so if you'll click on the link, and this is just an individual activity, I think maybe we told our hosts that we were going to do small group, but I don't think we need to. I think it's just an individual activity. We'll give you about 4 minutes to go into Google. Angela can pull up the Jamboard and share it. So as you're putting your sticky notes on the Jamboard, we'll see your answers, and then we'll come back together and talk about what you found out as a whole group. Awesome. Well, we're seeing some stickies answering the question of what is the PN3 policy roadmap. And if you use the arrows up at the top, you can go to the other screens and start answering what are the effective policies that are in the PN3 policy roadmap, and then what are the effective strategies. We'll take just 2 more minutes. Awesome. All right, we're closing in on just our last few seconds. All right. Is there anyone, you guys did some good search engineering, some good Googling. Anyone who is willing to come off mute and just sort of answer the question of what is the PN3 policy roadmap? What did you learn in your Googling? You guys have lots of good answers up here. So the PN3 policy roadmap is really, it provides guidance on the most effective investments that states can make to ensure that young children have the opportunities to thrive. And so the roadmap sort of helps us monitor our progress towards adopting and implementing those effective strategies. And there are several policies and strategies that ensure young children, prenatal to 3, have what they need to thrive. And so, Angela, if you'll just click to the next Jamboard. So what are some of the effective policies? And we'll share sort of the full North Carolina roadmap in just a minute, but family paid leave, a state minimum wage, reduce administrative burden for SNAP, expanded income eligibility for health insurance. So those are some of the effective policies. And then if we want to go to the strategies page, Angela. Awesome, thank you. So what are some of the effective strategies? Early Head Start, early intervention, childcare subsidies, screening and referral, and home visiting. Awesome. All right, so I'm gonna have Angela share just a piece of one of the North Carolina's report card, if you will. And I'm gonna share the link with everyone just so that you have it in case you wanna read it later. But unfortunately right now, and Angela's gonna scroll just a little bit. Yeah, right there. And if you wanna make that bigger, that'd be great. Perfect, thank you. So you can see North Carolina needs to strengthen its PN3 system. There's no doubt about it. So expanded income eligibility for health insurance, we are actually regressive on that. We have some progress on an administrative burden for SNAP. There's some progress on paid family leave, which Angela talked about earlier. We have no progress on a state minimum wage and no progress on a state earned income tax credit. As far as strategies, we've made substantial progress in screening and referral and in evidence-based home visiting. So we have made some substantial progress there, but we've made little to no progress on subsidies, little to no progress on group prenatal care, little to no progress on early Head Start, and some progress on early intervention. So these are the policies that will be helping local communities learn, and they'll be picking, again, one or a couple of these strategies that they want to talk about at a local level. I just want to pause and see if anyone has any questions or reactions to this.
So if I'm hearing correctly, we haven't met the majority yet.
Correct. You are correct.
What are one or some of the main factors behind that delay or postponement, in y'all's opinion?
Well, I guess the way that I would answer that question is that we, meaning the citizens of North Carolina, members of the community, have not done our work in educating our policymakers about how these policies are really going to impact us. And to your point, that is why we are trying to do these deep dive community level discussions. So because the coalition outside of Think Babies, if you don't know about the coalition, we'll put our website in the chat. We do a lot of communicating with legislators at the state level, and we have lobbyists. And I asked our lobbyists recently about an issue that we're working on, and I said, "Well, I don't understand why the senator still doesn't understand." And he's, the lobbyist said, "I'm just a lobbyist, So that's where the beauty comes in of those of you who live and work in the communities that these folks are representing. Your stories are going to be so much more impactful than my lobbyists trying to explain to the legislators why these things are important. So it's kind of a both and. It's really good that we have lobbyists. It's really good that they can keep their pulse on, what's resonating with legislators and what isn't. But we have to layer that with that community level conversation.
Thank you, Jenna. That was a great response.
Sure. Any other questions or reactions? All right, well, we will move back to our presentation and talk a little bit more about what Think Babies has done around racial equity and how we pivoted in the process. So if Angela wants to pull up the racial equity piece, thank you. So we do want you to know that our colleague, Kristen Davis, was supposed to be here and presenting. It wasn't supposed to just be Angela and me talking this whole time, but she is unfortunately dealing with a very sad family emergency. So I am taking over her slides, so please forgive me if I fumble through them a little bit. But our leadership team has undergone a multiple year process to do a deep dive into racial equity and to examine all of the practices that the leadership team employs using a racially equitable lens. And we have a racial equity assessment about the workings of the leadership team and how many of the ways in which we operate are still rooted in that systemic white supremacist dominant culture where, and if you haven't done a deep dive into white supremacy culture, I highly suggest that you do. But a lot of the sort of experience and education is more important than, and by experience, I mean work experience is more important than lived experience. People who have had access to more education are the ones who have more voice at the table. And I mean, we could go on and on about all of the things that we are doing. And so right now we are in a chrysalis, which, you know, we were a caterpillar before, we were a strong caterpillar, we were a group of many organizations doing really good work. And now it's time for us to get in that chrysalis and sort of break down those systemic racist ideas and operate in a new way that ensures all voices, all perspectives are honored equally. And we're moving forward in our phase 2 of the racial equity work, where we're really doing that. We're examining all of the processes, all of the ways in which we've operated, and taking a new approach to our work. So Angela mentioned one thing we've done is, in an effort to really build relationships, we're having meetings monthly. And we're going to do, in our next 6 months, we're going to do a deep dive into relationship building so that all folks feel like they know one another and they're comfortable with one another and are valued and equal. So this year, as I mentioned earlier, we've done the micro grants for a few years. But this year we applied for that special grant to give even more money to communities to do this very specific deep dive conversation with their legislators. But we are very guilty. I am very guilty of taking the old micro grant application and just revising it. And so when it was sent out, it was not received well. It was a lot of words. It was very confusing. It seemed like we were asking for a lot without a lot of money attached to it. And we heard that concern. And we scheduled meetings with our partner orgs who were having those concerns. And they said to us, it was confusing. It was really written with a white lens, and it was asking too much of BIPOC-led organizations that really don't have the organizational structure and organizational support to do a project like this. And so although it was really difficult to hear and really hard to have that conversation, we were so grateful that we have that level of trust with our partners and that level of openness, and that we received their feedback openly. We pivoted, we rewrote, reclarified the grant to ensure diverse participation. We asked those folks who provided us feedback to help us rewrite the grant, the RFA for the grant. And again, it was very difficult, but it was really important. And we were able to explain to the entire leadership team what had happened, why we did what we did, and we have been we've just developed those important relationships even further, and the level of trust is continuing to strengthen amongst the different partner organizations. So one thing we heard when we were receiving that feedback is that it seemed from the RFA that we were asking a lot. And so what we did was we really made it clear in the rewritten RFA that each community will be assigned a coalition staff member. And that staff member will build a relationship with your community, with the community, to provide all kinds of assistance to whatever the grantee may need. So for example, a grantee may want to plan the donuts and coffee event and might not need help from the coalition. But another community might need the coalition to call the donut shop to ensure that there will be enough donuts, to ensure there will be enough chairs set up, to help order the coffee to go with the donuts. It just depends on each community, and we're really trying to ensure that the support we give is responsive to that community and not just trying to do a one size fits all type of support. Next slide.
I have a question.
Oh, yes, please.
Okay, so when it comes to this and these areas that we're discussing right now, is there a lens or a platform that's created for the more of poor rural areas especially when it comes to the diversity and equity, because sometimes I feel like that, poor rural areas that are more disenfranchised are the ones that's not heard from.
Absolutely. And that is a really great point. And that is that was a big focus for us, and why we really heard that feedback about what is a rural disenfranchised community. How can we best support those communities to be a part of this project? Any other questions before we're going to announce our communities? And so you will hear a little bit about rural versus urban and all the different types of organizations that are receiving the grant this year. So the Partnership for Children of Wayne County will hold 3 events, and they are hoping to target a broader audience to allow for some flexibility in attendance. So we're excited to work with Wayne County again, who is also a previous microgrant recipient. So the Lincoln Heights Community Center is actually in the northeastern part of the state, and they are, to your point, Cherie, a rural community who doesn't have access to a lot of resources. And we are really excited to be partnering with them. They're going to be doing some free classes, some information sessions, really bringing the community to the table to learn about early childhood and to learn about how early childhood impacts the entire community. The National Birth Coalition is going to invite policymakers to learn about a lot of the prenatal, postpartum, and BIPOC issues and the disparities that exist in our state between a woman of color who's giving birth versus a white woman who's giving birth. They're also going to uplift and center grassroots efforts that different BIPOC organizations have made in communities during the pandemic and then hope to do in the future. Child Care Resource Center is one of our more urban programs out of the Winston-Salem Forsyth area. And they are going to meet with their local and their state legislators to discuss the PM3 policy roadmap and really highlight those issues in the newsletters that they send out, going to parents, childcare providers, the community, to kind of keep that conversation going and keep it top of mind. The Children's Council of Watauga County is one of our rural counties in the mountains. They're going to do a family-friendly event where families can come and really have that face-to-face conversation with their policymakers and provide opportunities for the parents to share their stories.
So Tina and I can take care of some stuff.
Empowered Parents in Community is going to be hosting Popsicles on the Playground. Again, another family-friendly event to really get families out and be able to share their stories. Because as we know, it can be really challenging to ask parents who are completely burdened with their jobs and the immense amount of work it takes to be full-time caregivers for young children. It's hard to get them to find extra time to communicate and talk with their policymakers. And this is a really great way to get families to come and talk with their policymakers. And then Smart Startup Transylvania County is another rural county in the southern part of the mountains of our state. They really do have a successful community collaboration. And they will be building upon the strength of their community collaboration to request time at city council meetings, childcare programs, and again, bring those lived experiences to their policymakers.
And then this
I'm gonna
yeah,
go ahead. Yeah, thanks.
Sorry, Jenna. We're winging it. So this somewhat wonky disproportionate map gives the same information as a more proportionate map. These are all of our Think Babies micro grant community partners since we started doing that program. So the counties in blue are previous, have organizations that have been previous recipients of the micro grant grants. And then the counties in orange are the ones where the organizations Jenna just mentioned where they reside. So I hope what you see is that it is, we're spreading, that the Think Babies work is getting into more and more communities across the state. I did a rough count and we have about 25, so about a quarter of the state, the counties in the state have been touched by Think Babies community partnerships. And so we want to keep going. We want to spread that from the mountains to the coast. And so we are excited to have those connections with the communities and also build that advocacy work in the communities. And so if you see your community, your county on this map, and you're not aware of any Think Babies work that's been going on, we're happy to give you that information. I see in the chat, the northeastern North Carolina counties, yes, they are very rural counties, and we have, that has been a goal to get counties to participate. We've had a hard time reaching those and getting county organizations in those counties as applicants. So we have done some extra outreach. Dare County out there was our first kind of most eastern applicant in the round before this one. And then now we have Halifax, which is, I believe, where the Lincoln Community Center is. And so we are trying to get more participation out in that part of the state as well. And I see the question, when will the next grant opportunity be? It will not be sooner than a year from now. We do about one per year, depending on the funding and our opportunities. So hopefully around this time next year, we'll be sending out another RFA. So what thoughts, questions, ideas do you have based on this information and presentation? Happy to take some questions if y'all want to come off mute. Reading Lisa's comment.
I have really enjoyed this presentation. I'm the Family Engagement Leadership Coordinator at Columbus County Partnership for Children. And Think Babies is one of the organizations that we've been looking into to participate with. I really appreciate all of you and all of this information, and I'm going to take it to my family leaders and discuss it with them. And do you have any recommendations for them, or things that we should do to get started? I mean, what do you suggest?
Sure. Well, I would first, suggest checking on our website, the Think Babies website, and I'll put that in the chat again. There's a lot of resources there, a lot of county level resources to give information about the state of these policies and programs in your county. We do have a mailing list as well. You can sign up for our Action Center. And what we love is when our partners and those on our Action Center mailing list share with their communities as well. So when those action alerts go out, share them even further, and those support advocates in communicating with their legislators. Thanks, Jennifer, for putting those links in the chat. And as things come up, if you are looking to make connections with your policymakers and we can support you in that, definitely reach out to one of us. We'll put our contact information in the chat as well, because we want to support, it's our goal, is to support the communities and connecting with their policymakers.
I would appreciate that. Thank you.
Thank you, Lisa.
Thank you. I appreciate y'all.
I also just want to add, that we do have a brand new infant toddler childcare landscape study that talks about specific infant toddler needs across the state and within each community. And we will be releasing that soon, and we'll have a webinar where our researchers will do a deep dive on Wednesday, May 25th, and I will put the link in the chat. We also have, for those of you who perhaps in the past have participated in Strolling Thunder, we would love for those of you who are able to join us in Raleigh at the Legislative Building on June 9th to come and to share your stories. And we would love for families from your areas to come and join. And we have the applications for the families in both English and Spanish. And it's going to be a really great day. And so we would love for you to join us there as well.
Will you put that information in the chat?
Mhm.
So I just put there, we have an interest form about Strolling Thunder. I just put that link in the chat. Let us know if you're interested in participating. We'll make sure you're the first to receive registration information when it goes out, and keep you posted as things develop. And it's got the information, the date and the time.
Thank you. Will this be a hybrid meeting or just in person?
Unfortunately, hybrid is really hard to carry off for live outside events. Our gathering will be on the lawn, the legislative lawn. So there'll be a lot of activities for the kids. We're hoping, we wanted to avoid families feeling the need to bring their children into the legislative building. So we're really trying to make it an outside focus where the legislators come out and interact with the children. So there is a lot of digital advocacy that happens on that day. There's a digital toolkit that will go along with those materials, so you can participate in that way as well and really lift the voice on social platforms.
That sounds awesome. Maybe I can take a field trip.
Yeah, come on.
Awesome. Thank you.
I just definitely like to echo Lisa's just thanks for the information, all the great work y'all are doing. And before I ask kind of my two-pronged statement, Brenda had a great question too that I wanted to echo. It was, can you share any policy changes locally in the ones who have participated?
Oh, thank you for highlighting that. I missed that in the chat. So I think the biggest local policy changes have been on the front of paid leave. And that is not the area of focus of the coalition. Like we mentioned, the Moms Rising really does a lot of work. So I'm not going to be able to name those communities that have really spearheaded a lot of work. But what I know that when we began the Think Babies initiative, there were between 12 and 15 local municipalities, and now there's over 20 that have really carried that work forward. It's a little harder to get forward movement on childcare at the local level. There are some that have implemented some, ballot initiatives as far as funding childcare, and it's kind of a double-edged sword because it makes progress for that community, but then it also increases inequities across the state. If you think about, for an example, some of our more progressive communities, Orange County, Chapel Hill, that have great systems in place and great support and money, to get the increased funding at the local level in that community, whereas some of the more rural communities that don't have the funding and maybe also not the political will to move those things forward. We really want a statewide movement on that. So we have made progress too. I'll find the bill tracker that we have as well, or Jenna, if you know where it is, that we can put in the chat for things that have made progress in this last legislative session as well.
So just to make sure I'm a little bit of clarification. So the paid leave isn't necessarily a direct initiative of the coalition, is that correct?
So the North Carolina Early Education Coalition.
Before I ask a question, sorry.
No, you're fine. Because it does get confusing. The North Carolina Early Education Coalition has been around for about 30 years, and our focus has always been on early childhood, birth to 5. Think Babies initiative, which the coalition is a backbone of, focus is prenatal to 3, and the things that impact babies and families. And so that's this newest initiative. So as far as paid leave and the Early Education Coalition, they haven't always gone hand in hand. But because of Think Babies, now we work towards a more systemic policies of everything that support babies and families.
Gotcha. So with that being said, I was just curious about work being done with, we've had some small conversations here in my work about like fathers' involvement and whether the need for potentially like a paid leave for those first 3 weeks within transition of having a child, developing those routines or trying to develop those, and just the father's involvement in a support system or another caretaker, maybe that's not the father, right? So I was just hoping to hear your thoughts about that for my first question. And the second one would be how, if we're interested in potentially looking more for like direct involvement on the team, what those opportunities and when they might arise and the processes behind that.
Jenna, if you want to take that, I think I can find that bill tracker that we were looking for.
Absolutely. So I think absolutely we need paid leave for all parents, not just moms. And as Angela said, our partners at Moms Rising, I would love to connect you to Moms Rising because they do a lot of work with both, fathers and mothers, specifically on the paid leave issue.
Awesome. And then just the processes about direct involvement in y'all's work as a part of the team, as part of just consulting, other than like attending meetings and sessions. Is that like an application process? Yeah, I won't blab.
Do you mean becoming a part of the Think Babies Alliance or the mini grants that we talked about today?
Becoming a part of the alliance, whether that be formally or like informally.
Yeah, so we have, that is a really great question. And it's part of our racial equity work right now is to kind of break down sort of the way that in the past we've invited folks, to our table, which is not equitable in any way, shape, or form. We need the table to be built by all of us together. And so I would encourage you to just send me an email. I think Angela put my email address in the chat. And we can talk a little bit more about that. So anyone who's interested in learning more, or if their organization is interested, please send me an email or send Angela an email, either one of us, and we can talk about your org and how it would fit in and where we're at in the process of growing the team.
Awesome. Thank you, Jenna. Thank you, Angela.
Absolutely.
And everybody else.
If may intervene, Terrell, because speaking of Moms Rising, they offer a lot of training. Actually, all of the training, or 98% of the training that I've had for family leaders and stakeholders has come from Moms Rising with our Family Leadership and Engagement Coalition. A lot of great information on there.
Thank you, Lisa.
Well, I know that that the folks at the conference, Eric and Ann, want to do a raffle. And so again, I am so energized and excited by all of your participation today. Please don't be a stranger. Please reach out, join our mailing lists, and you'll get all kinds of information about all the things that we're doing. And again, if you have a targeted question, please feel free to email Angela and or myself anytime. So I'm going to hand it over to Eric to do the raffle and hope somebody in here wins.
Thank you, Jenna. Yes, I'd like to first thank everybody for coming today, and to Angela and Jenna for a fantastic session. And now we are going to randomly select one of our attendees for a prize from Teaching Strategies, one of our sponsors right here-ish, something. So one Natasha Duggins. Is she still here?
Yay, I'm here. Awesome.
So I'm going to send you a message through the chat.
Okay. Great. Thank you so much.
My pleasure. Thank you for attending. Wasn't it? Okay. And yes, thank you so much for coming today. And I've put a link to the survey for the session in the chat, and the conference materials will be put on the website as soon as we can in the session descriptions. So if everyone enjoy the rest of the conference, and have a good afternoon.
Thanks, and we'll get that that bill tracker in the post-conference materials as well. Thanks, everyone.
Okay, I've got Natasha's info, so I'm going to go ahead and close. Everyone have a good afternoon.